It's wonderful to be here. A very warm welcome to all our participants wherever you are in the world. And I'm going to just share my screen now. And I'm going to be talking to you very broadly about vaccine hesitancy and just giving some global trends on what it's looking like in terms of COVID-19 vaccine, some communication tips we've learned from vaccine communication science over many years, and also some thoughts about responding to misinformation, which is, of course, the challenge of our time. But I want to start with the context, because context is always key to how we manage any communication issue or hesitancy more generally. And we are in a formative time. It is a volatile environment. We have people whose lives have been severely disrupted, with people who are grieving, people who are still fearful. And now we have this global vaccine program beginning to roll out. And people tend to be normally cautious with new vaccines. And of course, that's been, I think, accentuated with this pandemic. Usually beliefs and attitudes towards vaccination of children, for example, are reasonably stable. It takes a while to start affecting them in populations. But in COVID-19 vaccination, those beliefs are shaping right now. So what happens in the communication environment has a very strong agenda setting role. And of course, as we all know, the activists against vaccination are energized, and we will see their messages come out no matter how much we try to censor them. So we've also seen them join with lockdown protesters and others who object to the constraints the pandemic has brought on liberties. But I want to start with a broader picture of vaccine uptake, because whilst we do tend to focus on hesitancy, vaccine uptake is not just about hesitancy. And in fact, we, with our increasing vaccination model we're using with WHO, would locate hesitancy here. It's a motivational construct. It's an intentional phenomenon. It's not a behavior. The behavior is vaccination, the action of vaccinating oneself or one's child. But that hesitancy or motivation is influenced by what people think and feel, their snap judgments, their confidence in vaccine safety and its benefits, social processes, what others in their environment are doing, people that they trust, people that they look up to, social media influences, and practical issues. And we must never forget that uptake is not just about what goes on in the heads of people. It's also about what goes on in their environment and how services make it easy for them to access vaccination, how they're reminded by systems, and how we can ensure that there's equity of access to vaccines, not just with supply, but through very accessible services. Now, what's interesting about vaccination is that we tend to get the language a bit jumbled up sometimes, and we call people who aren't going to vaccinate anti-vaxxers sometimes. But what this recent research from Imperial College and YouGov has shown is that when you ask people whether they'll take the vaccine or not, among those who say they won't, there's a proportion who are opposed to vaccines in general, say with France, 9%. But right now in France, 48% say they won't take the vaccine. So not wanting a COVID-19 vaccine doesn't necessarily mean that you're against all vaccines. And that's an important distinction to make when we're thinking about how to manage the issue of hesitancy around COVID-19 vaccines. And we've conceptualized the different positions on COVID-19 vaccination in this way through thinking about the communication tasks that might be required. So there are people who are Anti-vaccination activists. They're small, they're vocal, we all know them. There are people who are rejecting and intending to reject the COVID-19 vaccine. There are people who are hesitant, they're not sure. There are people who are accepting of it. There are people who really want it and they'll line up. And there are people who are advocates. And the communication tasks with all of those groups are similar, but they're also different. We may want to do anything from minimise the impact of anti-vaccination activists right through to supporting the advocacy and the keenness of those who are advocates with good information tools to share in their networks. With the Global Advisory Group on Vaccine Safety with WHO, we've developed a communication module around vaccine safety communication. And we've drawn on the principles of risk communication, which say that you need to prepare for all sorts of events, and particularly with COVID-19 vaccination, like any new vaccine program, there will be incidents and events that come up, whether they be around safety or delivery of the vaccination. And preparing and setting up the lines of communication now before those events occur is crucial. We need to identify threats to confidence. We need to listen to audiences, use communication science in helping develop messages, and then pre-test those messages with target audiences. For example, in Australia, if you were to say smoking is deadly to an Indigenous person, an Aboriginal or Torres Strait Islander person, that would have a completely different meaning to how most people would take that, because the term deadly in Australia for First Nations people is a very positive thing. It means something is good. Oh, that's deadly. So pre-testing, because the meanings for different audiences will be different. Working closely with the media. Journalists in general want to see vaccine confidence sustained. So working with them in those good motivations, helping them access good sources, good information in a timely way is absolutely crucial. And building a social media presence and ensuring a good clinic experience will also help shore up resilience against all the various threats to vaccine confidence. This is a quote from a study by Amy Crichton in Gomeroi country in New South Wales in Australia, which is someone talking about the importance of engagement in primary care. So the service may have spoke to one mum, but guess who that mum has spoken to in the next couple of hours? 20 mums, and she is passing that on. You might not have that flash brochure, but the power and the time that you've put into her, she is putting that into her friends. So whilst we might have challenges with social media, we also have strengths in other networks and in social media networks as well, where people can be sharing positive information and positive influences around encouraging vaccination or encouraging people to have their concerns addressed. So let's get to responding to misinformation. It's important to be strategic here because there's so much, and because there are opportunity costs in responding. It will take people's time away from other important things. It's important to choose wisely when to respond. Is it being shared a lot? So that's not just about counting the volume of messages out there, for example, the volume of tweets. It's about counting the potential exposures to those messages, because some people don't have many followers on social media, but they're sending out a lot of misinformation, whereas some people will have a lot of followers and one tweet will have a much greater reach. Is it affecting behaviour potentially? Using behavioural science, using research to determine that, looking at coverage trends, and preparing people, if it is doing either of those things, preparing people, or what they call psychological inoculation, which is giving people small doses of that opposing view so that they're ready for when they see it in the wild, if you like. And this communication handbook here has just been developed by Stefan Lewandowski and colleagues. and is a very practical guide for addressing all sorts of issues, particularly COVID-19 vaccine misinformation. Another handy guide is developed by UNICEF and colleagues, which is a vaccine misinformation management guide, which has some useful tips like what it looks like to give people factual information that's intended to debunk misinformation, from starting with the fact, warning people about what they're about to hear, telling them what the fallacy is, and then ending with the fact. So you make the most of that recency and primacy effect, what you hear first and what you hear last. And for responding to misinformation, of course, using trusted spokespeople. Don't feed the trolls, because they're just going to suck energy out of you, and they'll probably be given more attention and oxygen. Often we have discussions and debates about vaccine safety or effectiveness or necessity, when underneath that are the real issues, such as people's desire for protection. Sometimes they see themselves as needing protection from vaccines. The worry about the purity of the body and maintaining that, and that moral intuition of purity versus disgust that vaccines can ignite in people. The desire for self-determination and choice. Some people are processing grief and trauma through the issue of vaccination, particularly those who might believe a vaccine caused their health problems or a relative's problems. And belonging, if someone believes that they're part of a network that doesn't vaccinate, then they may not want to vaccinate because they want to belong. So all of these things are important to address in some form, even if it's simply acknowledging them mentally, while staying calm when you encounter things that you know are wrong and get frustrated with. We've developed for individual clinical communication these vaccine communication pathways in talking about immunisation.org.au. And we recommend that there's this process of screening where people are at. Are they ready? Are they hesitant? Are they intending to decline? And using different communication tools depending on where they're at. But what's common here is the importance of recommending vaccination to people if you're a healthcare professional or any advocate. The timing and the tone might differ depending on where people are at, but a recommendation is powerful. And it's particularly powerful if you can build rapport with someone to begin with. So take-home messages. It is a formative time for these COVID-19 vaccines. It's not just hesitancy or motivational issues that affect uptake, it's also practical issues. Good communication and good process and experiences with healthcare, with vaccine delivery, will build program resilience. Use communication as a two-way process, not just broadcasting. Use communication science, including to address misinformation, understand those deeper issues, and in the words of Victor Montori, who's a guru in shared decision-making, be careful and kind. And in finishing, I want to share with you a picture of Professor O'Donnell and I in Italy when she hosted me as a visiting professor there at the University of Parma. And of course, we're eating Italian food. And on the left, some resources there from WHO that are just out around using data to inform program planning, communication guidance, dealing with misinformation. Lots of resources there. So have a look at those if you want more information. Thank you very much.